So what is the solution? What is the fix for this? How do you balance a woman's hormones in order to help for these issues?
Well, the first thing that you need to do is figure out which ones are off. So sometimes that requires testing, and the reason I say sometimes is, we do know that that hormone testing is it's not a very specific art, because of the fact that if you draw somebody's blood and you look for a hormone level, what you're going to find is a hormone that has already been bound to a protein to be traveling from one place to another. So what you pick up is just what's in the bloodstream. It doesn't give you a reflection of the tissue concentration of these hormones, or reserve levels, or what's already in a certain spot doing something. So sometimes they can be helpful, sometimes they can't. We're getting better testing out there now. We have a great test right now that women might be interested in, called the Dutch test, where you take a urine sample and send it back to the lab that does this, and they dry this and then they crystallize it, and they're able to pull apart all of the metabolites, which would be once a hormone's been used, there's going to be a metabolite left over from that chemical reaction, and they can get really accurate about what this whole map looks like in a woman, everything from thyroid hormone to progesterone, estrogen, testosterone, cortisol, on and on and on and on. So we first might start with an assessment like that of looking, where are these things off? Now, also a lot of this, Shawn, comes with just clinical experience. I've been doing this for 25 years. If I'm talking to a woman who's 47 years old, who is in the midst of perimenopause and moving quickly towards true menopause, it's not that hard for me to ask the right questions and figure out, okay, we've got an issue here where progesterone levels have dropped too low, estrogen levels have remained high. The ratio between those two is getting further and further apart. It's causing estrogen dominance, which is going to lead to things like heavier periods, mood swings, weight gain, especially in the abdomen. It's going to slow down the thyroid function. So sometimes these things don't actually need to be so much tested as they need someone with the experience to guide this person and ask the right questions and kind of get a feeling of where they are, so that you can build a roadmap that would include, dietary changes, maybe some nutritional supplementation, maybe some bio-HRT therapy. That would be hormone replacement therapy. And I think that answers that.